Tana River County is one of Kenya's arid and semi-arid lands severely affected by recurring droughts, leaving many communities struggling with food insecurity and limited access to essential services. Children under the age of 5 are experiencing high rates of malnutrition, while pregnant and lactating women continue to face significant barriers to accessing essential health and nutrition services, particularly in hard-to-reach areas with poor road networks and limited outreach programs. In response to these challenges, the Kenya Red Cross Society, with support from the Kenya Humanitarian Fund and UNICEF, is implementing an integrated drought response project aimed at scaling life-saving health and nutrition interventions within the affected communities.
So Tana River is one of the counties that was selected to participate in this project, or rather to benefit from this project, because most of the communities faced drought and also issues of food insecurity. This was noted during the short-range assessment, where some of the households were identified to be at IPC 4, while most of the households were identified to be at IPC 3.
To effectively implement the project, Kenya Red Cross Society has been working in coordination with the Ministry of Health, including healthcare workers, community health assistants, and community health promoters, to conduct door-to-door mass nutrition, screening, and integrated medical outreaches within drought-affected communities across Tana River County, as well as joint monitoring and supervision activities in partnership with UNICEF. These activities aim to ensure that pregnant and lactating mothers, together with children under the age of 5 years, are able to access health and nutrition services, particularly in hard-to-reach areas, while also help to assess and monitor the current nutrition status within the county.
We have almost 16,000 children below 5 years who have cases of malnutrition in the county, and almost 3,000 pregnant and breastfeeding women also having malnutrition cases. We appreciate that Kenya Red Cross came in, at least supporting us with integrated outreaches, whereby we have 35 sites being supported bi-weekly. These outreaches have really helped us in reaching the vulnerable population, especially in the hard-to-reach areas. And we really achieved a lot in this because in as much as we are in the drought situation, it has really mitigated the impact of drought because health services have been continuous. This has helped in improving our indicators, especially the imam coverage and also immunization coverage. And also, we have also tried to manage the minor illnesses. So we are handling the mobilities at the outreach levels, and also ASC has been also part of the package of the outreaches. So all the pregnant mothers can be accessed through the medical outreaches.
Before the outreaches, we used to have children even over 1 year, having not received any immunization at all. But currently, we are at par. Children are receiving their immunization at the stipulated time, and also the ANC mothers are able to receive services.
Through the continued support of the project, many vulnerable families have benefited from the interventions. Among them is a mother from Agimsa village whose child was identified with acute malnutrition during an outreach exercise. After being referred for treatment and enrolled in a nutrition program, the child gradually recovered, showing notable weight gain and improved health. As drought continues to affect vulnerable communities, integrated health and nutrition interventions remain critical in protecting the lives of mothers and children.
The activities have come in handy keeping to the fact that the drought really affected most of the households, these communities are really far. So getting health services is a problem, because of the long distances between the households and the health facilities. You might get a community is very far from the health facility, even up to 30 kilometers. So accessing these services becomes an issue without the outages, the integrated medical outages. Then we get to record so many missed opportunities from the immunizations of children that need to be immunized, and also.
Despite the remarkable progress made in mitigating the impacts of drought, the journey is not yet complete. Several manageable gaps remain, presenting opportunities to strengthen the response, expand access to essential services, and build lasting resilience for communities facing recurring climate challenges.